What's been the role of health plans in the expansion?
I'm a clinician. I'm not an administrator. But I think we've been very welcoming of patients into the plan. We're advertising certainly to attract patients to the plan. But I would say from an economic vantage point, it's been a mixed bag. There are a number of things, as we were talking about earlier, that need to be fixed that aren't going to be fixed now to ensure that there is that health plans can remain in the market. I think that's the biggest challenge right now, is to those fixes that will allow health plans to remain economically viable in that exchange marketplace. I think the other thing that you brought up was access. Have we improved access? I'm not sure. We haven't changed the number of physicians in the country. We haven't changed the number of ER physicians. I think there was this expectation that with the passage of the ACA that now patients who were previously going to the emergency room for their care would now go to a primary care physician. Well, we didn't increase the number of primary care physicians either, so we certainly improved payment access, but I don't know that we've improved clinician access under the ACA.
Well, the DISH funds went away ostensibly because people were going to have access to primary care physicians. I also haven't seen a wholesale expansion of nurse practitioners to provide that role, nor change in scope of practice with legislative perspective. So I think that is, the access issue is a genuine concern. As from a political point of view, and I think Elizabeth will start with you, but I would really encourage the others as well to help. We heard John raise the question of maybe one of the grievances is that issue is healthcare a right or is it a privilege? We've had other functional issues raised as to whether or not the law has actually been effective. So if you were to characterize the grievances that led to the formulation of the Republican healthcare plan and then subsequently led to its rejection, what would those key issues be?
Yeah, so I think a couple of things. You start fundamentally with the fact that the Republican Party has not aligned on what replacing the Affordable Care Act looks like. And so on one side, you have a group of individuals in the Freedom Caucus saying, this is Obamacare light, this doesn't go far enough. We want to roll back a lot of those patient protections that we just articulated earlier in this segment, things like guaranteed issue, things like making sure that health plans cover the 10 essential health benefits, those types of reforms. And then on the other hand, you have, for example, 20 Republican senators that represent states that expanded Medicaid. And so some of the Medicaid provisions in the law were very troublesome. Members who really have kind of grown to accept and embrace many of the market reforms who weren't comfortable with where sort of the Freedom Caucus was taking the bill. And so, unfortunately for House Speaker Ryan and Republican leadership, the party kind of is pulling the policy in the bill in opposite direction. And the question is sort of if they can come together and find a policy that reflects, both sides' ideology.
So I'd like to make this a little bit more real. So recently I had reason to send some letters to Congress and the Senate about the Affordable Care Act and the American Health Care Act. And access was a major focus of that. We need to be sure that patients with pre-existing conditions can continue to get affordable health care. We need to eliminate lifetime limits so that people can get lifetime health care. And we need to, be sure that the high-risk pools aren't there so that patients can actually afford the health care. Health care that they can't afford doesn't help. And one of the responses that I got from a staffer in one of the congressman's office was, no patient with cancer has ever died because they don't have health insurance. I'm sorry, I'm a practicing clinician. I have seen patients die because they couldn't afford their health care, usually because they had no health insurance.
Me too.
Patients die if they don't have health insurance. And that's really what this boils down to. Are we as a society, are we as a medical system and culture going to configure healthcare so that we recognize that we just are writing off some lives? Or are we going to recognize that healthcare is a right and that we as a society have a responsibility to figure out how to responsibly deliver affordable health care to individuals in our society.
Yeah.
You know, it boils down to that.
Yeah.
And, you know, I personally don't care what it's called, as long as I don't have to watch people die because they don't have a big bank account.
Yeah.